Hello beautiful people, welcome back to my channel. It's Chisom here once again. Thank you all so much for stopping by today, and thank you all so much for clicking on this video to watch. If you've not met me before, I'm Chisom, a wife, a mom. I'm a nursing student here in the UK and I'm from Nigeria, so welcome to my channel. Please, I encourage you to subscribe to this channel and turn on your notification bell so that when I upload new videos, you'll be one of the first people to know. And to my returning subscribers, you all are amazing. Thank you all so much for always coming back to this channel to watch my videos, okay? I am really grateful. I do not take your support for granted. So thank you all so much for being here with me and for being here for me. So today we'll be talking about clinical placement. On this video, I'll be explaining clinical placement, what it's all about, what we student nurses do on placement, how long or the duration of for each placement, what we are supposed to achieve for each placement. Okay, so if you want to know what clinical placement is all about as a student nurse, please keep watching this video and make sure you watch till the end. All right, thank you. So guys, I want to say that whatever I'm going to say on this video will be based on my personal experience and how my university organizes their placements, okay? So university placements may vary from university to university depending on which university you are and depending on your cohort, okay? And because we are not all placed in the same place, all of us will not have the same opinion about clinical placement, okay? It may be different experience or it may be the same thing, but NMC standard is the same thing for every student in the UK. So it is the same number of time that every student in the UK is supposed to achieve for their particular program. And it's the same competencies, the same thing in one student's PAR is what you will find is in another student's PAR, okay? I will explain what PAR is, PARA, later, maybe in another video or as we progress, okay? So whatever I'm going to say is based on my personal experience, all right? So first of all, what my university did was, before we started our placement, we were placed under different trusts. Here in the UK, a trust may be in charge of 4 to 5 or even more different hospitals, okay? So despite all of us being in the same cohort, we get different trusts, okay? And despite being in the same trust, we are in different hospitals. And despite being in the same hospital, we are in different wards. So it depends on where you're placed, okay? We don't all get the same thing. Some of us are placed in the community, some of us are in the hospital, some of us in the GP, some of us in like something like a care home, something like that. So we all get different kind of placements, okay? But we are all expected to achieve the same number of hours for that particular placement. We are all expected to achieve the same skills for that particular placement, no matter where you're placed. And we are all expected to achieve the same competency, no matter where you're placed, okay? So no student, it doesn't, like, it is the same thing that we are expected to do, that everybody is expected to achieve the same thing no matter where you're placed, all right? An instance is this: some of us get a hospital placement and in a ward. Some of us get a hospital placement but in outpatient, all right? So for example, if we are expected to learn how to do cannulation, this is an example, in this placement, in a particular placement, all right? Someone that is in the outpatient may not get the opportunity to cannulate a patient because obviously outpatients are just patient, like ambulatory care patient that just comes and goes and comes and goes. They are not admitted in the hospital most of the time and all that. So what that student is expected to do is go for a spoke placement in a ward that does cannulation. It is allowed. So it is called spoke placement. For everything you cannot achieve in your original ward, you are allowed to go to another ward where you can achieve those competencies, and so that you can learn those things and sign them off. Because your PAR is where you sign your timesheet. Timesheet is where you record the number of hours you've achieved for that placement. And each placement has a particular number of hours you are supposed to achieve for that placement, all right? An instance is if placement 1 says before the end of placement 1 we are going to achieve 217 hours. It means that everybody in that cohort is supposed to achieve that hour. All right, because we are human beings, there are unforeseen circumstances. Something may happen and maybe you can only achieve 200 hours. It is still fine, but it means that you are owing 17 hours, which you will carry over to your next placement. And when you carry this hour over to your next placement, you add it to the next hour you are supposed to achieve for that placement, and it makes it difficult. So that is just the thing about not being able to achieve your hours when you are supposed to achieve them. All right, the same thing with competencies, because there are things that we are supposed to learn or achieve and sign it off for that particular placement. An example is bed making, for instance. All right, so if you are expected that in this placement you are supposed to learn bed making and sign it off, all right, if you do not sign off bed making for placement 1, you are going to carry it over to placement 2. All right, and then you sign it over. Sometimes you cannot even move further to placement 2. You go into something called retrieval. It means that the most important things that you are supposed to achieve for that placement, you have failed to achieve it. So while your cohorts, while your mates are in placement 2, you are still in placement 1. All right, so that is why it is important to write down everything before you start your placement. Find a book. We all have like a small notepad that where you write down everything that you need to achieve for that placement, so that immediately you start, you are being assigned, or you will be assigned a supervisor or an assessor. No one sends a student to placement without any guidance. Okay, so your assessor and your supervisor is in charge of you. They are the ones that takes care of you, that teaches you everything you need to know. It is not as if it is a must that you practice with your supervisor or your assessor. Sometimes if your off duty is different, because most of the time 90% of the time your off duty is the same thing with your assessor. But if for any reason you are not able to be on the ward or in placement at the same time with your assessor, you will be expected to practice under a qualified nurse. All right, and that qualified nurse will be able to tell your assessor, yes, these students have done cannulation, these students have done bed making, these students have done catheterization, and your assessor can sign it off for you. Okay, so that is basically how placements work. I don't want this video to be too long, because talking about placement is like there's a lot to talk about when it comes to clinical placement. Okay, so clinical placement is just basically when we are just sent out to the different healthcare settings to learn some skills, these skills that will help us when we eventually qualify as staff nurses. All right, and just like I've said before, we get different places. Even if we are in the same hospital, some of us get ICU, outpatient, coronary care, heart care units, different types of placements. All right, so we are all sent. Sometimes someone in your class can be in the same placement with you, so it varies from placement to placement and from year to year. Okay, so what we do depends on, or what you will do during your placement, they also depends on your level or your year. Okay, so for first year we are expected to practice with guidance. Okay, but for second years and third year, for second years we are expected to practice with minimal supervision. Okay, and for third years we are expected to practice independently. All right, so for we that have done this that is practice or studying nursing for 2 years, our first year and second year is combined together. So it's divided, there's a way they divided it. Okay, but right now if right now we are expected to practice independently, because we are almost going to qualify. All right, so what you will do depends on your year, and also depends on your trust policy, because some trust will allow you to do some things while some trust will not allow you to do some things as a student nurse. Okay, secondly, I want to tell you guys that Getting ready for your placements, make sure you get comfortable shoes, because if you are placed in a ward, in a very busy ward, it means that you will be on your feet for close to almost 11 or 10 hours, and if your shoes are not comfortable, your feet is going to tell you. Okay, so comfortable shoes is the most important thing for every student, or for to have by every student. Okay, so we all get comfortable shoes that will make us that even if, no matter how busy the world gets, we will not notice that you've been standing for close to 6 hours or more. All right, so get your comfortable shoes. Okay, so am I forgetting anything? The duration, sometimes it will be 6 weeks, sometimes 12 weeks, sometimes 15 weeks, and the 15 weeks is always management placement for the final years that is almost qualified. Okay, so they are in the end of their program, so the end of their program, the placement is always longer, like close to 3 to 4 months even. Okay, because they are expected to practice and then transition from student nurses to qualified nurses. Okay, so that is just what placement is all about. We wear our uniforms just like I'm putting on now. This is our uniforms, but sometimes you will be placed in a ward where they do not wear uniforms, like the ICU. They don't wear uniforms in ICU, they wear scrubs, and other places. Okay, so if you are placed in such ward that does not wear uniform, then it's fine. You can wear scrubs as a student, just like I'm putting on in this picture, because I was placed in a place where they do not like wear uniform. They wear uniform, but because it's like in a place where they have to like enter a theater and do some procedures, so we also wear scrubs when I want to go to the room. So it depends on where you're placed. Okay, but majority of the time we are all on uniform. You see students from other universities too in the same ward with you. You still see students that are in different cohorts, different years, or that you see first year students, you see second year students, you see final year students, different students, you see them in the ward. All right, so, and our supervisors and assessors are in charge of teaching us everything we are going we are expected to learn for that placement, and to make sure that we are okay. All right, we also have academic assessors, and academic assessors are like the lecturers we already know. So they also look at our part to make sure to remind us that, for example, after 2 weeks they are supposed to sign something called like initial interview. Or so if your academic assessor can look and see and find out that you've not signed something on your part and time is running out, they will send you an email and remind you that, okay, you've not signed this thing, you have to make sure and find a way to sign it off, because maybe time is running out. So there are a lot of things to sign on par. All right, especially timesheets and all these things. So as a student, and it is our part that is submitted to the NMC at the end of the program or at the end of the training, and it is in your part that the NMC will see everything you've done. Your supervisors and your assessors will be making comments about you. If you are stubborn, they will write it there. If you are badly behaved, they will put it down there. Everything about you will be in your part. All right, so it is good that we all be and to be in your best behavior, and to wear your appropriate uniform, especially the shoes. Okay, if your trust policy says that students are not allowed to wear shoes with laces, then you are not allowed to wear shoes with laces. But if the trust says students are only allowed to wear black shoes that are wipeable, like when something, a fluid spills on it, like you can easily wipe it, then that's the kind of shoe you can wear. If your trust say you can wear Crocs, then it's fine. So we just find out the what the trust policy says about the shoes, and then that's the kind of shoe we all get. Okay, so this is basically what placement is all about. And after the placement, we all submit our PAR back to the university and back to the exam board. The exam board will then sign off everybody that is up to date. People that are not up to date, that have left something out, they will go on retrieval. All right, so it means that during the next placement, when others are in part 2, there are some people that will still be in part 1, because there are things that they are supposed to sign off in part 1 that they have not signed off. signed off. Okay, so they must finish that part one before going over to part two. And some of these things, it causes delay and frustration. Honestly, placement is not easy. Honestly, it's not. In fact, everything about studying nursing is not easy. Okay, so it is advised that you just do everything you can to make sure that you are always up to date. Make sure your timesheet is signed every week, and make sure your competencies, all the competencies you're supposed to achieve for that placement is achieved. Okay, so I don't want this video to be too long. If I keep talking, I've said this thing before, there is a lot to talk about. So if you have any questions about placement, just ask me down, put them in the comment section. All right, so depending on how long, how many times we go on placement, sometimes 3 times in a week, it for 12 hours. That's if you are placed in a ward that runs a 12-hour shift. Okay, so you just work as a qualified nurse if it's a 12-hour shift, because we are expected to work for 37.5 hours every week and nothing more than 40 hours a week. Okay, and if you are placed in outpatient, it means that you will be going to work from Monday to Friday, but it's from 8 to 5. All right, but some people that are in the ward goes to work, depends. It's from sometimes from 7 to 7:30 in the night, or from 8 to 8:30 in the night if it's a 12-hour shift. Okay, but some people that are in day surgery outpatients, they just go for placements every day of the week, but from 8 to 5. All right, so it varies. And some people are also in the community. I've not gotten any community placement before. All right, I've always been in the ward, except once that I wasn't in the ward, so I was going to placement like 4 times a week. All right, but the other ones, the rest of my placements have always been a 12-hour shift, 3 times in a week. All right, so this is all I could remember when it comes to placement. If you have any questions, just put them in the comment section and I'll answer your questions. Okay, so guys, thank you all so much for watching this video. I didn't want this video to be too long. All right, thank you all so much. That is why it seems like maybe I left some things out. I don't want it to be too long. Thank you for watching this video. I am absolutely grateful to you. Please, if you've not subscribed to my channel, please subscribe to my channel. Give me a thumbs up if you love what I do on this channel, and do not forget to share my videos. Okay, share them and turn on your notification bell so that immediately I upload new videos, you'll be one of the first people to know. Okay, so thank you all so much for watching this video, and I hope you've learned one or two things. All right, thank you all so much for watching, and have a lovely day. Bye.